Yeah.
You started off with
Attention to him, that's more important.
Huh?
you started off with a protein that was relatively low, 0.5 grams per deciliter. It's down to 0.3. It started off at 60% of your total protein in your blood, and now it's down to 6%, so a 90% reduction. All right, if you look at the light chain, which was 200, well above that. When you started off, your light chain was 1,000. Now it's down to 2.
Okay.
And when you looked at the marrow, there's extensive involvement of the bone marrow when you started. Now they occasionally see an aberrant plasma cell, less than 1% of the total, 1%. So a very good reduction. If we look at where that happened, when was your transplant?
100 days ago. I don't know.
So your initial chemotherapy took you from 1,200 down to 90, and then we took you from 90 to 2 on the free light chain. If we look at your bone marrow biopsy just prior to transplant, we saw, what was the total percentage?
40.
15%. We're down to 1% post-transplant. So we still see the disease, but we would call this what we call VGPR, very good partial response. All right, and that's very good. That's exactly what it means. So in terms of what's next, the next thing is to refer you back to IFTY and for him to talk to you about maintenance therapy. And maintenance therapy would be just a pill form of Revlimid.
Yeah, that's what you said, a low dose.
Low dose continuously. And just keep an eye on you. See you in clinic and continue on the...
No, that's why. You want
the Iridia. Were you on Iridia before?
Yeah.
So you would restart that.
So is this the best results that you can see from...
Well, what I would say is this is a very good result. Okay? I'm very happy with what the transplant did for you.
Right.
Okay? Could it have been better? Yeah.
Sure.
It could have been complete response.
Right.
But I have a lot of patients who don't get to VGPR who are just partial responses. So I would say that the combination of therapy that you've got has had a very good effect on you, and you tolerated it. You're now through it, and our goal is to keep you in that response as long as possible. And time will tell how much benefit you got. If the disease comes back in 3 to 5 years, that's a pretty good benefit.
Sure.
And if the disease comes back in less than a year, not so much.
But it's still there, though. It's not like it's gone.
It's always going to be there. We can still measure it, and the goal of the maintenance therapy is to
keep it down.
Now, would there be a benefit to doing a second transplant and putting you through it all again? Studies show that if you get this VGPR or CR, we don't do anything by getting you to a home. Now, IFTY will take a look at it and say, if you look at your actual paraprotein, now if we look at the actual paraprotein as a measure of your response, you didn't have that much of a paraprotein to begin with. And it's
what
still,
is that?
That's on the SPEP. That's this one right here, paraprotein. Interpretations, do the interpretation. That's the whole antibody. So we started off, actually, no, I missed the boat on that. The paraprotein was 9 grams, and we're down to 0.4 grams. So you had a great response.
Okay, can you print all that for me?
Maybe I can print them out for you and get you copies of them, and then you can say, this is what I went through all that shit for. And it seems, and if
she could highlight the ones that, she'll print
everything is better. So then again, the chemotherapy took your total antibody population down from 9 grams to 2 grams, and the transplant took it from 2 to 0.4. So the chemotherapy did its job, and the transplant seems to have. Now, how does that translate to the most important? How long before the disease comes back? And that's really the reason to go on the maintenance therapy, to keep that disease from coming back. And we won't know the answer to that question for hopefully years. Okay?
So what will, like, how, so now I'm done with you, unfortunately, or whatever, and what normally would be the visits with IFD since,
Probably monthly.
monthly?
Far less often than we were seeing you. Up front, but
Yeah, would that be, something where he would take blood work every month, just to?
just to
make
see how
sure
your counts are doing.
counts
He might do it a little more frequently up front, but
Right, because I'm just.
and then the further out you are, the less frequently he sees you. You can move. So in terms of getting back to home, New York City,
Vegas. Vegas.
Vegas, or going on a trip, or moving to Vegas.
Moving to Vegas.
Now, after you've been on the Revlimid maintenance for a few months, and you're tolerating it well, and your counts are tolerating it well, that would be a good time to transfer.
And how long would that be?
I would wait at least a couple of months to make sure you're tolerating the Revlimid therapy.
Yeah. Okay.
The alternative is not to do